Well, welcome to this video. We're thinking about vitamin D again today. Now, you get all sorts of people on the internet and on YouTube talking all sorts of rubbish about their pet theories, and they're not worth anything unless they're backed up with evidence. So for the past few days, pretty well exclusively for the past couple of days actually, I've been looking at the evidence for vitamin D and immune function, and I've really become quite convinced by the argument. And it does fit in with a lot of observations that we're seeing. So I'm going to present quite a bit of evidence in this video. Now, if you want to skip it and cut to the bottom line, I'll give you the bottom line now. So vitamin D is necessary for normal immune function. People with low levels of vitamin D will have reduced levels of immunity. And this does seem to predispose them to viral infections and to bacterial infections. We don't get too much vitamin D from our diet. A lot of vitamin D comes from the sun. And in a lot of northern areas, and indeed far southern areas in the world, we don't get enough sun for much of the year to produce enough vitamin D. Therefore, a lot of us are deficient. And the other important point here, and this explains or may explain a lot of the data we're seeing around the world in this pandemic, is that the darker your skin, the more slowly you produce vitamin D. So if I'm in the sun for an hour, I'll produce so much vitamin D. If someone with much darker skin than me is in the sun for an hour, they'll produce less vitamin D, depending on how dark their skin is. The darker, the slower the vitamin D is produced. So this means that people with darker coloured skins are more prone to vitamin D deficiency. And it can also be a particular problem in Islamic women as well, who are covered a lot of the time. So the evidence for taking a supplement of vitamin D, I believe, is strong enough for you to ask your healthcare provider if you should be taking a supplement of vitamin D. And I'm going to start giving you some evidence for that now. Now, just before so you can skip that now. I've told you what I want to tell you. But if you want to stay with the evidence, then that would be absolutely brilliant. Now, just before we start, it's very confusing because there's two ways to measure vitamin D dose, the dose of vitamin D. So there's the international units method and there's the micrograms method. So there's 1,000 micrograms in a milligram and there's 1,000 milligrams in a gram. So 500 international units of vitamin D is 12.5 micrograms, and that's sometimes written mcg, or sometimes this UE squiggle here with a G. That's some Greek letter or something. But that and that mean exactly the same thing. And 1,000 international units is 25 micrograms of vitamin D. So remember that 1,000 units is 25 micrograms, because that does get a bit confusing sometimes. Now, let's get straight down to the evidence. Now, the first line, and all this evidence, of course, I'm going to post. You can click on the links yourself. Make sure I'm not making all this up. This has to be evidence-based. Now, this is from Public Health England, and this is their vitamin D recommendations. So Public Health England are saying, so this is not me saying, this is Public Health England, and click on that link. People should consider taking a daily supplement containing 10 micrograms of vitamin D in autumn and winter. So there they're giving a dose. They're advising a dose. And this is a very conservative dose. It's a relatively small dose. So for example, here's the ones I got from Morrison's. They're the Aldi ones. You can get them anywhere. I get mine from supermarkets. So this is from Morrison's, and this is 90 tablets. They're quite cheap, and these contain 12.5 micrograms. 12.5 micrograms, if you can see that. So 12.5 micrograms is going to be 500 international units in those tablets. These ones are a bit stronger. These ones contain 25 micrograms. So these are twice as strong as those ones, or contain twice as much vitamin D. So 10 micrograms of vitamin D a day. So they're recommending a very conservative dose here. Now, they then go on to say, African, Afro-Caribbean, South Asian backgrounds may not get enough vitamin D from sunlight in the summer. In other words, they're being very polite, but they're saying the darker your colour the skin is, the less you're going to make. So even in summertime, if you live in England, especially where I live in the north, or you live in Scotland or somewhere, and you've got dark coloured skin, then you're probably not going to make enough vitamin D even in summertime. Therefore, you should consider taking a supplement all year round. That's the advice from Public Health England. I'm not going to argue with it. Now, it goes on to say children aged 1 to 4 should have a daily dose of 10 micrograms of vitamin D supplement. Now, this is a bit strange. So what they're saying here is children should have 10 micrograms, and people, which presumably they mean adults, should have 10 micrograms. So to me, if children are having 10 micrograms, adults would need double that or triple that. But this is their guidelines anyway. So that's what they're saying. Children 1 to 4 should have 10 microgram vitamin D supplement. Public Health England recommends that babies are exclusively breastfed until around 6 months of age. So presumably what they're saying is that below that age, you give the vitamin D to the mother, and then the mother will pass the vitamin D on to the child in the breast milk. And then they go on to say, as a precaution, all babies under 1 year should have a daily 8.5 to 10 micrograms vitamin D supplement to ensure they get enough. So again, they're actually saying here that babies and adults get the same. I don't quite get what they're saying, but anyway, it's not my duty to inform Public Health England how to write their guidelines. That is what they are saying. So this is, to me, is strong evidence that they're saying vitamin D is important, and because they're recommending it nationally, to me that also means that it's going to be fairly safe. It's certainly in those doses that they are advocating, which are low doses. Now this one was from a nutrition magazine, not magazine, a peer-reviewed journal. These are all proper journals, nutrition journal, where nutritionists and clever people like that write in. Now there's these two things. These are both immune proteins. So these two immune proteins can lower viral replication rates, and these immune proteins can be deficient in vitamin D deficiency. So when there's enough vitamin D, we can make enough of these proteins, and that can lower viral replication rates. And that, of course, is good. It's reducing the rate at which viral particles multiply. It's exactly what we want. And this is interesting. And reduce concentrations of pro-inflammatory cytokines. Now, cytokines are these hormones or these chemicals that one cell uses to communicate with another cell. So one cell communicates with another cell using these chemical cytokines. And some cytokines promote inflammation. So good levels of vitamin D is going to reduce the concentrations of pro-inflammatory cytokines. So if you reduce the amount of pro-inflammatory cytokines, in other words, you reduce the amount of inflammation, which is great. Because in COVID-19, if we remember our alveoli diagram like this, these hollow bunches of grapes, these alveoli, where the air goes in and out. So that's the bronchiole, the air goes in there, we breathe it out there. And the oxygen goes from there into the blood, and the carbon dioxide goes from the blood back into the air to be breathed out. Now, part of the problem with COVID-19 is that people can develop ARDS, acute respiratory distress syndrome. And that is basically an inflammatory condition. So what happens is the alveoli and the airways become inflamed. And they become inflamed because of these pro-inflammatory cytokines. So they become inflamed, and then like when you sprain your ankle and it gets swollen, fluid comes out, so we get fluid collecting in there. And that means we get what we call consolidation and infiltration in the lungs. They fill up with fluid and therefore they don't work. Therefore the person gets no oxygen in their blood, therefore they can die. It's that simple. So that's how important these inflammatory processes are. So to keep down pro-inflammatory cytokines and infection is usually a good thing. Now, actually, it's complicated. I mean, that doesn't mean to say we should be taking anti-inflammatory drugs. We shouldn't. But for the vitamin D, we think it's a good thing. Now, increasing concentrations of anti-inflammatory cytokines. So we've said that. That's good. Right. Oh, no, we didn't say that. So it increases the concentration of anti-inflammatory cytokines. Right. So it's reducing the concentrations of pro-inflammatory cytokines, and it's also increasing the concentrations of anti-inflammatory cytokines. So both of these effects are going to reduce inflammation, which is good, usually good. Now, another line of evidence is the outbreak occurred in winter, including in China, when vitamin D levels would be lower. And vitamin D deficiency has been found to contribute to acute respiratory distress syndrome. So this journal is saying that there is empirical evidence for that theory that we've just sketched on the diagram there. And the case fatality rate increases with age and with chronic comorbidities. So in COVID-19, we know that the case fatality rate, the number of people that die, goes up with age and goes up with other diseases. And both of these, other diseases and increased age, are associated with lower concentrations of vitamin D. So I'm not saying that vitamin D is the only factor. Of course it's not. The other disease and the increasing age are factors. But nevertheless, this study by these nutritional people is saying that vitamin D deficiency is more common with increasing age, and vitamin D deficiency is more common in people with comorbidities. So that kind of hangs together. So carrying on with the same article, to reduce the risk of infection, it is recommended that people at risk of influenza, so they're saying that people with low levels of vitamin D are at risk of influenza and COVID-19. Now, this is not me talking. I do not prescribe. Don't